welcome. My name's David Somek. I'm the Network Director of the European Health Futures Forum. Our organization hosts the organization that is putting on these webinars, the Center for Empowering Patients and Communities. And Jim Phillips, who will be speaking during the course of this session, is the director of that. This project is funded by the Robert Bosch Foundation, but it stems from a long-term collaboration over at least 10 years, I would say, between people particularly interested in patient empowerment. So we go back to the 90s, really, with Jim Phillips, for example, working in the NHS on the Expert Patient Programme. And we had in the background two godparents, also Professor Ilona Kickbush, and on the one side, and Professor Angela Coulter, who've been great champions of patient empowerment over the years. It's only really in the last 20 years that things really took off. The setting up in the last 10 years of the ENEPI consortium, which Jim was largely responsible for, was something which promoted the use of the Stanford self-management model in Europe, and that continues. However, in addition, a number of us were involved with the European Commission in promoting patient empowerment and self-management via, for example, the Empathy Project, which was in 2014. And a year later, ENEPI became a formal organization and indeed came under the umbrella of EHFF, where it's been since. We've also had strong support from the European Patients Forum. And finally, I'd mention the fact that the big project, the European Innovation Platform for Active and Healthy Aging, also had a small subgroup on patient empowerment, and a number of us were involved in that too since 2013. So coming to the present time then, in 2017, 2018, Bosch gave us the funding to set up this project, which has been going now for 3 years. And one of the parts of the project was to set up an expert group internationally who are, as it were, at the leading edge of patient empowerment. And we have a selection of that expert group presenting to us today. I'm delighted. They're all old friends, but they each represent a different aspect of what's going on at the cutting edge. So I'll start, if we don't mind, with Christine Sorensen, who is the head and leading light of the Global Health Literacy Academy. Is sitting in Denmark at the moment. And Christine, over to you.
Thank you very much, David, and thank you for the invitation to share some views today on how we can transform the medical model. So our Center for Empowering Patient and Communities are really about trying to enhance people-centered health. So there's been a lot of focus on how we can enhance the people-centered views on health, and it's also sometimes called how can we humanize health, and we should think that was a natural thing to do, but still we know from our research that there is a big gap of inequity and inequalities in health. And today I wanted to share a perspective on how we can start maybe changing even the language we use about vulnerable groups in order to reduce this gap of inequity. So we are talking about transformation, and one of the illustrations that is often used is this transformation from a caterpillar to a cocoon to a flying butterfly. And I had this in mind when I prepared my presentation, because how we often see groups we want to help is that we label them vulnerable groups. And if we look at it from a human rights perspective, there is a long list of groups that are, labeled vulnerable, such as women and girls, children, refugees, stateless people, minorities, indigenous people, migrants, elderly, people with certain diseases, Roma, lesbian, gay and transgender groups. And when we look at it from a more social disparity perspective, we often talk, in particular in my area of health literacy, about low educated, poor, homeless, addicts, unemployed, and so forth. So we add a certain label to specific groups of people. With those labels are also other labels used by professionals as hard to reach, that they're excluded, malfunctional, low, these are very negative connotated terms. And we often talk about also giving voice to the voiceless. Shows that this type of label also induce stigma unintentionally, of course, not really focusing on the dignity. It's about people feeling that they're being misunderstood. They say they have a voice. We don't need to give them a voice. We just need to listen. They feel that they're being alienated or being acting in a hostile environment, that the communication is not given to them. So it comes, this use of language somehow induce also a new context for them in which they have to act. So often when we talk to people from these groups, they say, for them, they experience it's the completely opposite. It's not them that are hard to reach, it's the services and the systems and the people acting from as professionals. So there is this gap that we should try to look at if we want to really increase the people-centered efforts and also try to transform our system. So coming back to my initial illustration of transformation, we could say that the way we do right now in the current perception is that we look at people as having very few skills, as being static, being hanging there in their situations, not being able to do much. They cannot fly, they just have to hang there. But if we want to change our focus in the next slide, we could look at really the asset that they have, their skills to transform, and provide them the skills to actually fly and become this beautiful butterfly. So this is a challenge I want to give to you, really. How can we talk to people with other labels so that we don't stigmatize them? How can we call them people, participants, respondents, priority groups, rather than using words that have this negative connotation? And whatever we do, it's really about acknowledging that these groups that we try to target, or usually target, that they are very diverse, and that we respect this diversity, and that we take not telling them what to do, but really take the time in whatever kind of interventions or services that we have, where we try to listen to their needs and meet them in their needs, and that we co-create and tailor our communication and our programs to these concrete needs, and that we facilitate in a way that really respect their position and what they can contribute, and that we support them in developing their assets, rather than focusing on that situation where they are hanging there with little opportunity and for developing their potential. So what I believe is really, if we want to see true transformation, we should move away from the fix and repair to really a focus that goes beyond fix and repair, and focus on the right to be and the right to become and the right to belong, focusing on developing butterflies rather than nurturing these caterpillars and cocoons. Thank you very much, and I look forward to any questions that there might be. Thank you.
Thanks very much, Christine.